We're back now and with Dr. Mark A. Perez. He is board certified in family practice. He's been 25 years in San Pedro community treating patients and families here. And he is now, of course, at PrimeMedical. Welcome, Dr. Perez.
Thank you.
We talked with Dr. Shaw briefly about screenings and why they are important, but would you tell us in your words, why are regular screenings so important?
Well, they're important because we want to improve our health, basically, okay? And today, heart disease is still one of the major killers, or the number one killer with patients. So one of the things that we can do to prevent heart disease is controlling different factors, which one of the factors is hypertension or high blood pressure.
Okay, so we're talking now about heart health and blood pressure screening, but in general, screenings are important across the board, correct?
Correct.
Absolutely. So let's talk about heart health and why is blood pressure screening important?
Well, blood pressure can contribute to a variety of diseases, including heart disease, it can go to renal disease, it can also include as far as stroke, and so those are all big killers, and we can prevent these by taking care of maintaining the blood pressure and not having high blood pressure out of control.
And blood pressure, they say, is the silent killer.
Correct. There's really no signs and symptoms. Some patients will exhibit some signs and symptoms when the blood pressure is really elevated. For the majority of the patients don't have any signs and symptoms. They feel fine and they function, they work, they do a variety of things and have no idea that their blood pressure is elevated.
Wow, so that's significant.
Yes.
Because if, we have regular, like screenings, how often should a person have blood pressure screening?
Well, regularly with their physical exams, every 1 to 2 years, basically, should have a high blood pressure.
Okay. And does this does not pertain to seniors only?
Not to all. Hypertension can develop at very early ages. I've seen 18-year-olds develop with high blood pressure.
Wow,
so
that's interesting. Is stress, is that the real cause, or are there other causes?
Well, one of the causes it can be as far as your diet and obesity, other contributing factors.
Okay, very true. Okay, so regular blood pressure screening for a healthy heart.
Correct.
And then, in fact, I have a list here from the Sunday paper.
Mm-hmm.
5 vital health tests you should not skip. That's why we're talking about these today. So we talked about the heart. Now, what about cholesterol screening?
Cholesterol is another major factor that contributes to heart disease. Okay. Mm-hmm. And so, again, there's a lot of talk about cholesterol, what's low cholesterol. And we found through studies that if you have lower cholesterol, it decreases your heart disease. And so there's a big push right now, you'll hear, about keeping low cholesterol, have low cholesterol foods and diet. And that's something that's very easily can be controlled by one at home by watching what you eat, watching the amount of cholesterol that you're taking.
So there are things that can be done for cholesterol without taking the prescriptions, such as you mentioned, diet?
Diet, yeah. I would say about 1/3 of my patients are not taking any kind of medication either for blood pressure or cholesterol because they've been able to maintain it with diet. I highly recommend to try that first. Supplements, fish oil, eating fish, low salt, a variety of different ways you can control it just with diet and not having to take medications.
Okay, that's great because I have a friend who was starting to have high cholesterol and the doctor wanted immediately to put her on the statin drugs and insisted, really, and she took the prescription, she went home, she started putting lecithin in her oatmeal in the mornings, and she went back and she was fine. She threw away the prescription.
Yeah.
So that happens. Okay, so let's talk about another major item, which is blood sugar screening for diabetes. I read an article that said that 7 million Americans have diabetes and don't even know it.
Yeah.
So let's talk about sugar, blood sugar.
Yeah. Blood sugar can be diagnosed just on a routine physical exam. We check, and we check that routinely on our physicals. But diabetes is a big, major contributor to a variety of diseases, especially heart. Mm-hmm. And it affects the heart, it can affect the kidneys, it can affect the eyes. A variety of people you've heard that have had limbs amputated because of diabetes. They've had, going on dialysis because of diabetes. They've lost their eyesight because of diabetes. So it's one of the ones that if controlled, can keep a person very healthy without having to have all these
right, and also even vision.
Correct.
And even hearing.
Correct.
It's like a killer. I mean, it's amazing.
Yes.
I know I have a friend of my sister who's heavily impacted, and she's even had a kidney transplant, and it's just unreal what she's going through. But she's maintaining, and she's still living a good lifestyle. So diabetes, it's a major factor in this country, particularly type 2 diabetes, and I was reading that we're one of the highest countries, as far as diabetes, and as you said too, obesity
Correct.
is connected with that, and lack of exercise, poor diet, lifestyle. Even children now are getting type 2 diabetes.
Yes, correct.
So that's an important one, blood sugar screening. So another one that we need to pay attention to is the colon cancer screening, colorectal screening. Talk to us about that.
Well, we talk a lot about heart disease, that heart disease is a big killer, but the number 2 killer is cancer, and one of the ways that we can prevent and check with colon cancer and get it early is by doing routine colorectal screenings, which can include a colonoscopy at the age of 50, or do yearly colorectal screenings where we just check for blood. Once a year test that we do. It's very simple. And again, we're able to check that so we can prevent and get colon cancer early.
And detected early, it is curable.
That's curable.
Totally.
Exactly.
But so many people wait, and they wait way too long. I know I have a personal experience, friend of a friend who wasn't feeling well for some time, but did not like going to the doctor, did not have regular screenings. Finally, her son convinced her to go to the doctor. She found out she was in stage 4 cancer. Within a week or two, she was gone. So that's why we're here today. We really want to avoid this ever happening to anyone else.
Correct. And again, colon cancer, if caught early, is treatable. And so it's not something that has to kill someone or someone has to die of. So again, and just by a colon screening that we do, especially if there's a family history of colon cancer, we check at a much early age.
Okay, so that's important.
So that's very important.
I know I had my first this past year, and it took a lot of courage and gumption to get me there.
Correct.
It was, kicking and screaming, not really, but it was, I was so glad, and it worked out fine. And then the other thing I found out really after is that you could also at the same time have the esophagus?
Right, endoscopy at the same time. Endoscopy, so they can check to see for stomach cancer or ulcers if you suffer from a lot of heartburn. Right. I mean, one of the things with the screening and the colonoscopy is that you're sedated, you're asleep. I had mine recently done too, and I didn't feel a thing, and so it's not uncomfortable at all. You don't feel anything.
So it's good to have both, and the next time I'm going to. So how many years should this take place?
Well, they recommend every 10 years to get the colon screening, and if there's a family history, you should have it done every 5. Okay, or if there's any abnormal polyps, because we can have some polyps that are growing and we'll watch them, or that are not, but those, for some reason, those polyps can become cancerous, and so again, we'll screen those much sooner than the
Okay,
5 or 10 year period.
good to know. Now, the vision and hearing screenings, these are things that affect us with aging. So, talk to us a little bit about that.
Well, again, another cause of blindness is glaucoma, and by getting your eyes checked and getting them on a regular basis is something that, again, could be prevented, and people don't have to lose their eyesight because of that. So, again, we're trying to say keep people healthy, and we can do that by routine screening, eye screening. And again, that's part of our annual physical exam that we do, is we send routine annual screening for glaucoma and vision. So we do that. And the other thing is hearing too, as well. As with age, we tend to lose our hearing, and so again, we can, if you notice that you're not being able to hear, people are talking to you, or you're having to put the volume a little bit louder on the TV,
Or you're reading lips.
or you're reading exactly.
A lot of us do that.
Right. To get your hearing screened. Okay. So.
Like my sister says, to hear well, I have to have my glasses on.
Exactly.
Okay, but finally she got hearing aids and she's doing better.
Yeah.
And hearing, I've read that can affect the brain, because when you're not hearing well, the brain is tending to shut down.
Correct.
So that, to me, that's really significant.
Correct.
So those are really important. Then one more, there are screenings specific to women. We'll talk with Dr. Shaw, but for men, the prostate screening. Talk to us a little bit about that.
Well, we do basically two parts of the prostate screening. We do what's called PSA, which is a blood test, which screens for prostate cancer. It's, again, when we do your routine blood tests for diabetes and all the rest of your cholesterol, we check for, again, your PSA, your prostate screening, to check for prostate cancer. Okay. The other thing we'll do is we'll do a rectal exam. And again, most men don't like the rectal exam, but we do that once a year to, again, check for any nodules on the prostate, or to check if the prostate's enlarged. So again, those are routine once a year type of exams that we'll do.
Really important.
Correct.
Well, this has been really helpful. Medicare and health insurance cover most of these screenings.
Correct.
Not all. Medicare may not cover hearing, for hearing aids and that kind of thing, but for those watching, we need you all to equip yourselves with these screenings on a regular basis, whatever your healthcare provider recommends. Thank you, Dr. Perez, for this great information.
Thanks.